I am talking to you this morning about Tenex from Tenex Health. The Tenex procedure is a non-invasive procedure for the treatment of chronic tendinopathy. And us in this field have probably dealt with our athletes chronic tendinopathy. I know in football we dealt with a lot of patellar tendonitis. This procedure was developed in collaboration with the Mayo Clinic. It was designed This patent technology was designed, I totally am lost. Oh, to remove the necrotic tissue and reduce the healing time and cost. The indications are for all types of tendinopathies, medial and lateral epicondylitis, plantar fasciitis, Achilles tendonitis, patellar, and rotator cuff. When you failed traditional treatments, conservative treatments, you go to advanced treatment options, which are your cortisone injections, which can be controversial, your arthroscopic debridements, your growth factors, your PRP, which you've already heard about this morning, your stem cell therapies, and your tenotomy, fasciotomy. Has anyone here heard of tenotomy treatments? Okay, so tenotomy is basically where they go in, they numb your tendon with lidocaine or bupivacaine. They take a 22-inch needle and they basically stab your tendon over and over and over. So that's not like a great treatment, but they do get pretty good results. And the Tenex is based off of this type of treatment. So this is what the Tenex procedure is. This is the device. Actually, I brought it with me, so I'm going to show it to you real quick. It's pretty small. I got this from Dr. Kendall's office, who I've been working with. So this is the Tenex device. This is how big it is. So it's an ultrasound guided percutaneous tenotomy. So instead of using the needle guided, they use this, and it's only a 2 to 3 millimeter incision. So there are no strips, so it's very non-invasive. It's done in office. It's a high frequency ultrasound. So basically it's a very fast vibration, so there's no cutting required. It's 20,000 vibrations per second coming through here. It also has irrigation and aspiration, so it's removing the necrotic tissue just as fast as it's vibrating. It only takes 1 to 2 minutes, and the reason it's so quick, the doc says to tell him every 30 seconds. So you're telling him every 30 seconds he takes a break. So he wants to have all of the necrotic tissue removed before the 2-minute mark. There's no damage to the healthy tissue, no sutures, and it's done in office with no anesthesia. It's local anesthetic. So very uninvasive. This is just a photo to show you. This is a doc in office. You can see the ultrasound on the table there. That's a picture of the ultrasound where he's going in. You can see she's just in her normal street clothes. Not a big deal. It takes just a few minutes. The bottom picture is the actual Tenex. You can see the procedure hooked up to the hoses. One is for the vibration, the other is for the irrigation. And the bag there is where the necrotic tissue and the irrigation go. This is another example for the plantar fascia. Placement example on the top right corner, you can see the damaged tissue in the dark gray area. Status post is on the bottom when the tissue is completely healed. So it stimulates the body's natural healing process. This does take 6 to 8 weeks to a few months, depending on how damaged the tissue was. So that's an example. So this is a comparison between the Tenex and surgery. It's a pretty huge difference. Tenex is inexpensive. It's an outpatient procedure, low risk of infection. You're back to work the same day as long as you're not in a strenuous job. It doesn't require that you have crutches or bracing. Typically, doctors will provide that if you need it, just for comfort level. And you have a rapid recovery of 6 to 8 weeks. Whereas if you do a debridement or other surgical procedure, you're looking at a high cost, a hospital stay, possibly a risk of infection, sutures, and long PT, and a long recovery of 7 months or more. So a clinical study that I found had 13 patients with 14 different types of tendinopathies. All of these patients had already failed conservative types of treatment. Each patient received 1 Tenex procedure, which is normal to do just 1 Tenex procedure. They all started a slow progression of physical therapy at the 4-week mark. They asked an average pain scale at the beginning and then a status post at 12 months, and they decreased from 5.4 of pain down to 0.4, which is very significant. Their DASH score, which is disability of arm, shoulder, and hand, they rated from a 27.8 down to a 36 at status post, 36 months. And I think that's a typo of 0.4. It was very significant though. So in conclusion, I think the Tenex procedure should be a preferred method for athletes with a chronic tendinopathy that have failed their normal, traditional, conservative treatments. If they are an elite athlete or they're continuing on, they should consider the Tenex procedure because it does have significant results. It's very cost effective. It's covered by most insurance companies. If they were to pay out of pocket, the cost would be $2,000 to $4,000. It does have a much quicker recovery time than the surgical options as well. Any questions?